I'm so inspired from today, being able to see the model and start to take the next steps with the concepts that we initially had and the hopes that we had that the model would deliver us some direction and give us that wealth of being able to bring together the story of mental health for our region in collaboration with the data to really understand the need of the region, the need of the young people in our region, and to be able to advocate for mental health services for the region with the entire picture at hand. So I'm so excited and inspired to have that today.
Oh, it's absolutely fantastic to see everything that people have been doing and contributed actually into the model. It's wonderful to be able to simulate different scenarios, and it really gives an insight, like an incredible insight, into how different interventions can have an impact beyond what probably we thought, and gives us some rigour to make decisions about why we might advocate for certain interventions compared to others.
My big takeaway from today and what I really learnt about from the model was that there's a whole bunch of different factors that affect youth mental health outcomes. And it's not just about implementing these like initiatives and programs into the community, but it's also about ensuring that there's good uptake and like turnout, and that young people are like receptive to the actual programs themselves.
I think what I'm excited about is that we're quantifying some of the data around what works and what doesn't work historically, and we're creating a tool to measure that. So unlike previous times that we've probably come forward with ideas around practice, that we're actually trying to quantify it on a more geographical level and see what is actually working rather than a gut feeling or what that particular agency is seeing on the ground. We're using a collation of data from lots of different services. So I think that would be a little bit more of an accurate measure on how governments spend their money and how we implement practice and change in those communities. So
having a whole lot of different people and sectors work together to achieve this tool has been really wonderful to see, particularly the input of young people and people with lived experience. The other thing is really having the people that have got the scientific data know-how to really support the rigour behind this tool. It's been really fantastic. And the other thing I've loved about this is really that it's taken into consideration where we live, our region, and looked at the uniqueness of our region, particularly the impact of disasters that we've experienced in our region, and that's been taken into consideration when developing the tool.
I think it's really important that young people and people with lived experience are participating in these programs because, well, they've been through it and they understand what areas of their mental health they might have liked more support in, what things worked, and it's really awesome that they've taken young people on board and that they value they understand the value of youth participation.
when we talk about successful management of programs, we can often, especially for young people, we do have youth advisory committees, we do have boards where young people can advocate for an idea, but now we can take that idea and we can back it up with data and research, so in a geographical sense. And I really think that that will help young people in this space advocate for themselves further than what they've probably ever been able to do before.
It's been really good to get lots of people, and especially young people, because they're the people with the lived experience, and yeah, not everybody goes through that, so it's good to have the people there, especially when you're targeting younger people. You want to hear it from younger people who are also there as well at that stage.
Yeah, I believe that it's the right way to go, not to ask the specialists who deal with them, but the people who have the problems and the issues. I believe that's the way that you have made this run is very smooth, and the way it should have gone, I don't think I could have asked for anything better. Like, you did a real good job.
Yeah, fantastic.
I think it'll be a really good advocacy tool, so that we're better able to identify what different programs work and what don't, and then from there we'll be able to advocate for the implementation of different programs throughout the region.